Hey guys, it's Tina Sheth from Rebalance Physical Therapy, and I'm here to talk to you today about something called a diastasis recti. Now, we get lots of women, actually, and men, coming into our clinic all the time with, symptoms of low back pain, of incontinence, of some other issue that revolves around the trunk. And we evaluate them and we find that they have a diastasis recti that might be contributing to what is going on. We also get a lot of inquiries from women who have kind of diagnosed themselves or self-diagnosed themselves as having a diastasis, and they end up coming in. So, what is a diastasis? Well, a diastasis is actually a splitting of the rectus abdominis, or the abdominal muscles, from the center tendon called the Linea Alba of the abdominals. And I have a picture right here to kind of show you what it is. Now, if this is the abdomen, what you start to see is you start to see kind of a splitting. Now, that splitting can start and be very minimal, or it can become significant where you get more of a splitting. So the two walls of your rectus abdominis starts to split apart. Now, I want you to imagine, I'm wearing a vest here. Now, if the right side and left side of my vest kind of represents the rectus abdominis, what kind of happens is that the zipper unzips in the middle, and then everything underneath can kind of push out. And so that can be, your organs tend to bulge out in front of you. You can also have the umbilicus that ends up pushing out. And so you feel like your belly is almost distended. Now, who does this occur in? Now, diastasis can actually occur in both women and men, but it typically occurs in women, especially during pregnancy and postpartum after pregnancy, that it continues to remain. Now, a diastasis typically is kind of normal when you're pregnant, because as your pregnancy progresses, your belly starts to distend to make room for the baby. But afterwards, once you've had the baby, typically it should close and come back together. But in about 37% of women, this continues, and usually it's not diagnosed by their GYN or even their midwife after pregnancy. And for men, this can actually occur as their belly starts to distend and grow, or if they're not using their abdominals correctly, and you start to see a lot of strain in their younger years that progresses through their midlife as well, and then you start seeing this causing sort of back pain and other types of pelvic, hip, and back pain related things. So symptoms that you can kind of look for if you're suspecting that you have a diastasis is typically for pregnant women or postpartum, you're gonna feel that there's a gap or there's a lot of softness in the middle of around the belly button, maybe above the belly button and below the belly button. You may also see that every time you try to sit up or you try to raise the leg, this is in both women and men, that you kind of notice that something is bulging in the middle. It almost, call it kind of alien belly, but it looks like there's almost a vertical speed bump that's going from sternum all the way down to around the umbilicus or the pubic bone. And then the other thing you might notice is you never had an outie belly button, but now you are noticing that your belly button has turned inside out. Or you may just feel like, you know what, I'm actually skinny, but I still feel like I'm in my first trimester of pregnancy. And for men, you may just feel like your abdominals aren't flat and it just feels like you're distended all the time. So these are kind of signs of a diastasis that's problematic. And again, like I had said before, this can also be associated with low back pain. It can be associated with incontinence. It can actually be associated with pelvic pain as well, sacroiliac joint pain, which is the low part of your back, pubic bone pain, as well as any pelvic floor issues, which I have covered in my previous videos. So I hope that explains what a diastasis is. You can look at my other videos that explains treatments that treatments that can help for a diastasis. If you're looking to have it evaluated or assessed, if you are in the Philadelphia area or on the main line of Pennsylvania or any of the surrounding suburbs, you can give us a call and we'd be happy to kind of talk to you and give you an idea whether you have that occurring or not and what we can do for you, because there's a lot of different things that can entail treatment to close and conservatively manage a diastasis recti. So I hope that was helpful. You can also go to our website, www.rebalancept.com, for more information. Thanks. Have a great day.